Good morning, everyone. My name is Naive Brennan. My presentation focuses on social determinants of health in Broward County, Florida. We'll review the county's key health indicators, compare them with state averages, and discuss priority areas where nurse practitioners can lead impactful interventions to improve health equity. The goal of this project is to analyze how social and environmental factors influence community health in Broward County. We'll compare local data to state averages, identify key disparities, and propose interventions led by nurse practitioners. Based on the research conducted, our analysis highlights two pressing priorities, which are going to be housing affordability and child health insurance coverage, which have the greatest impact on overall population health and equity. What are social determinants of health? Social determinants are the conditions in which people live, not only the conditions in which they live, but they learn and they work as well. These go beyond medical care and include education, income, housing, and access to healthcare. The county's health rankings and roadmaps for 2025 reports that about 80% of overall health outcomes are shaped by these non-clinical factors. This highlights the needs for nurse practitioners to address social determinants of health through screening, being patient advocate, and collaborating with other members of the team. This slide summarizes Broward County's performance on major determinants. Broward has high median income and educational attainment than the state average, but still faces challenges with housing affordability and uninsured residents. Over 60% of renters spend more than 30% of their income on housing, one of the highest rates in the region. This pressure creates significant barriers to maintain goal health. When comparing Broward to Florida average, we see positive trends in education and income, but concerning disparities in housing burden and child insurance. Despite economic growth, affordability remains a serious issue, demonstrating that higher income does not necessarily mean better living conditions or health outcomes. Affordable housing is a major health issue. High rent costs lead to financial stress, poor diet quality, and delayed healthcare visits. Families forced to relocate frequently lose continuity of care, especially those managing chronic conditions. Overcrowding and homelessness increases exposure to infectious disease and mental stress. Addressing housing instability directly supports better population health and outcomes. What can we do as nurse practitioners in order to address housing affordability? Well, believe it or not, there's many interventions that we can incorporate in order to address this issue. For example, incorporating social needs and screening in order to identify patients at risk. Also, medical legal partnerships to address eviction and housing issues. Cross-sector collaboration, which aligns healthcare with social services, and advocating for policy change to ensure system-wide support for affordable housing and insurance access as well. Monitoring outcomes through public data demonstrates measurable impact. The second key issue is child insurance. Nearly 90% of children in Broward County are uninsured, higher than the Florida average. Following the Medicaid unwinding, many families, especially those with housing instability, lost coverage due to missed renewal deadlines. This leads to missed preventing visits and untreated developmental issues. Nurse practitioners can make a huge difference through simple structured interventions. They can help families re-enroll in Medicaid or Florida Kid Care, provide education about renewal deadlines, and advocate for outreach funding. These actions are especially effective in school-based clinics and community health centers. By helping families maintain coverage, nurse practitioners directly improve access to preventive and developmental care. Health equity outcomes. When housing and insurance initiatives are combined, these effects multiplies. These dual strategies enhance continuity of care, reduce preventable hospitalizations, and increase wellness and stability for families. This exemplifies how nurse practitioner-led evidence-based interventions improve both clinical outcomes and quality of life. In conclusion, Broward County demonstrates relative socioeconomic strength, but continues to face precedent inequities in housing affordability and child health insurance coverage. These determinants are deeply interconnected. Financial strains from high housing costs increase the risk of insurance lapses, which lack of coverage restrict access to preventive and chronic care, perpetuating avoidable disparities. As nurse practitioners, we are strategically positioned to lead multi-level solutions that integrate both social and clinical care. By embedding social needs screening in practice, partnering with medical-legal collaborations, coordinating with community organizations, engaging in policy change and outreach efforts, nurse practitioners can directly influence the upstream factors shaping health. Their involvement in primary care, school-based, and community settings is particularly vital for ensuring continuity of insurance coverage for children and families. Addressing these dual priorities, such as housing stability and insurance continuity, creates sustainable improvements in population health, strengthens family well-being, and advances mission of health equity in Broward County. These initiatives embody the leadership and advocacy expected of a doctoral prepared nurse, transforming evidence-based insight into measurable community impact. This will conclude my presentation for today. If anyone has any questions, please feel free to reach out. Thank you so much and have a good day.